Now, why should you invest in early intervention strategies? Investing in the Mind Blank team means you will be investing in our vision. And our vision is to become a world leader when it comes to early intervention and mental health practices. Now, there's research out there to show that every dollar you invest in health programs, there's at least a $5 to $10 return of investment. If you're working in the school community and you invest in early intervention strategies, you will be investing in a resilient future for young Australians. If you're in the community services and you end up investing in early intervention strategies, you'll see less mental health issues in community. And if you're in the workplace and you invest in wellness strategies, you will see decreased staff absenteeism, increased staff retention, increased staff satisfaction. It's a no-brainer. Now let's just really quickly revisit some of the case studies we had before. We had Sarah in that primary school setting who we were able to work with her and identify some habits that were potentially unhelpful for her. Now the reality is, if we didn't get a chance to see Sarah, what's happening when these students end up becoming bullies, there can be some pretty serious consequences on other students' mental health issues, which we have seen develop into depression, isolation, and even sometimes suicide ideation at that young age. These are what we want to prevent. Now, Kalika, we were able to see Kalika, who at the time she was sitting on the edge, giving up hope because she was sitting on a waiting list and she wasn't sure when it came to help seeking that there was help out there. Now, if we're not able to get to students like that, sometimes teenagers can learn unhelpful strategies when it comes to coping mechanisms of mental health and well-being. And what we are seeing is increased trends of things like drug and alcohol taking, which can be unhelpful behaviors that can lead to many, many years of pain and suffering. We were able to go to Jonathan's workplace, and one of the things we were able to do is build reinforced confidence and skill building for the first responder role. Now, if we didn't get a chance to go to workplaces like Jonathan's, what you'll be seeing is repeat offense of things like accidental counselling coming into play, where non-mental health professionals are trying to fill the roles, fill in big shoes that are not their responsibility, and they take the weight of the world back home. So these are some of the reasons why we need to be able to invest in prevention strategies. There are 3 options I'm going to give you now. Fill out the form below to see which of the options suits you best. Book now. If you've got an event or you've got something in mind that really you're ready right now today to book your team in, we'll offer you an additional 10%. Drop it in the comment box below that you're ready to book now. The second option is reach out to our team. Let's have a chat. We want to know how we can best service you, your team, and what you're doing in community to empower more mental health and wellbeing strategies. The third option that we have for you is actually do it yourself. We've created some online tools and videos where you can actually host your own conversations to kickstart some of the early intervention skill building. We're here to show you how to empower yourselves to be more resilient and to know what to do in a time of need. I hope that we've been able to add some value in what you do, and we're extremely excited about getting in touch and looking forward to seeing what we can do to support you and your community.